I have a prednisone warrior wondering if people take low doses of prednisone to prevent depression. And so first I'm going to read this prednisone warrior's question, and then at the end, I will give you my response. So first of all, before I move on, I want you to know that this is not medical advice. This is just general information based on my experience having helped lots of people on prednisone. And so this generally applies to people on prednisone, but you need to seek a medical attention from your own care team. As prednisone warrior said, I've suffered from PTSD and depression for over a decade. I've not taken any meds for either and normally only take vitamin D and vitamin B12, and I eat a whole food plant-based only diet. But I'm highly sensitive to poison ivy, and periodically I have to take prednisone for 2 to 4 weeks, including the taper time. Every time I take prednisone, my depression lifts. What a relief. And I feel like a normal person. I can do basic self-care and basic housewife and social things and experience joy with my family, etc. I don't get bad side effects from prednisone other than vision disturbance. But as I taper, the depression symptoms start coming back and I fall back into the hole. I looked over your blog, but I don't see any mention of this phenomenon in already depressed people. It makes me think the source of the depression is within the HPA axis, and prednisone is filling the gap. Have you heard of this? Do you know of HPA axis depression? How is it diagnosed or ruled out? How it's treated? And which doctor, specialty neurologist, is most likely to help sort this out? Does anyone just take 2.5 milligrams of prednisone daily to prevent depression? Okay, so there's a lot of questions in there. And first of all, I wanted to share that your experience of suddenly feeling a lot better after taking prednisone is pretty typical. It's called hypomania and euphoria. And I personally experienced it, and a lot of people do. At the very beginning of taking prednisone, you can often feel really good. But the thing is, it doesn't usually last. And so what you're saying is you taper down and the depression comes back. And even if you were to stay on it, depression might come back. But I can't say that for sure. The thing is, prednisone is not usually used as a long-term treatment for depression because it comes with so many side effects. It causes more side effects than any other drug in the world. It's the most hated drug in the world because it's so harmful. And so generally, the benefits don't outweigh the risks. But it sounds like you're getting a lot of really great benefits. I just don't know if they would last. So that's your first question. Is this normal? No, I've never heard of anyone taking it for depression. For depression, I would get help from two different doctors. First, for the depression itself, I would talk to a psychiatrist. And then, if you're wondering, maybe my HPA axis, your hypothalamic pituitary adrenal axis, is off. Maybe I just have low adrenal hormones like cortisol. And that's definitely possible. And if that's true, then you have a condition called adrenal insufficiency. But the only way to find out is if you get your adrenal hormones tested. And the best doctor to do that is an endocrinologist. And so I'd recommend you reach out to an endocrinologist and get your full panel of adrenal hormones tested to see if maybe in the morning you're not getting enough, or maybe in the afternoon you're getting too high, or something that's throwing off your balance of cortisol throughout the day and it's making you feel depressed. That's definitely a possibility. And if so, you're not taking it for depression. In that case, you'd be taking it for adrenal insufficiency, which is a very legitimate diagnosis, and it means your body's just not making enough cortisol. And so you replenish it, and that's great. But you don't want to just start taking prednisone without clear lab testing showing that you have cortisol deficiency and that you're working closely with a doctor to get you to the lowest effective dose you can possibly get to. And truly, only a comprehensive plan from your healthcare team is going to work for you. And then the psychiatrist can potentially help you find medications that can help with depression. What's tricky about depression medications is that it depends on your genetics, what is going to work best. And so if you're wondering, is there a way to find out what would work best for me? I actually know of a great resource for you. It's called Pharmacogenomic Testing. And this basically tests to see which medication, according to your specific genes, would work the very best. And I have some resources and references I can send you to of people who are experts in this, who can do a simple cheek swab to test your DNA to see which one would help the most. And so if you have that, just reach out to me at prednisonepharmacist.com/contact, and I can send you to the people that can help you the most. If you have any other questions, please let me know. Signing off as Dr. Megan, your prednisone pharmacist.